From its inception, the Bluebird Cafe is anything but ordinary. It's where megastars like Garth Brooks, Faith Hill, and Taylor Swift were discovered, and where emerging singer-songwriters continue to flock for a chance to perform original material. The Bluebird's policy creates an environment where both the audience and the songwriters can experience music in a quiet, intimate venue. This unassuming 90-seat venue, nestled in a suburban strip mall, is an accidental landmark that has significantly altered the landscape of Nashville's music scene. As an industry, there's one thing that we've been concentrated on in 2020, significantly accelerating our digital transformation. Just like how the Bluebird has transitioned to virtual open mic nights, we've worked to transform a once in-person experience to one where patients can receive the right help at the right time at their convenience. The shift from physical to digital is not a passing phase. We've been singing about a physician shortage for years, and telehealth has tapped into an enormous underutilized capacity. Leveraging the physician with the AI-driven doctor inside could be the solution we've all been waiting for. Thanks for joining us again. Now, in the round of the legendary Bluebird Cafe, Dr. AI has seen you, and here's the issue.
Good morning, everyone. This is Craig Samitt. I'm President and CEO of Blue Cross and Blue Shield of Minnesota, and I'm excited and I'm honored to be part of a distinguished panel this morning that's going to talk about one of my most favorite topics and something that's sort of very intriguing for all of us to focus on and consider as we live through a significant period of heartbreak and crisis and evolution, frankly, of our industry. I'm honored to be part of a panel of leaders. Sam Brouwer, the co-founder and CEO of doc.ai, Mona Siddiqui, the Senior Vice President for Enterprise Clinical Strategy and Quality from Humana, and Michael Sturmer, the SVP Health Plan Market of Teladoc Health. So good to be with you all. Great to see your faces. Thank you for joining us today. I know we're going to have a lot of fun. But before I torture you with some introductory questions, I thought I'd just give you all an opportunity to tell us just a little bit about your company and perhaps share a sentence or two of how your organization defines and is focused on the use of AI today. So Mona, can we start with you, and then Sam, and then Michael? Mona?
Sure. Well, it's great to be here. Looking forward to the conversation. Humana, I think you all know, as a large insurance company. I will say that not only are we focused on that, but also over the next several years, how do we become a healthcare services company with an insurance arm? You'll see the recent places where Humana has been focusing on, from investments in our home segment, investments in primary care, to really reach members, in a much more integrated and holistic way. So I think that is, you're going to see sort of an emerging and continuing focus for us. And then, Craig, I think you asked for me to comment on the AI program as well, or?
Yes, please.
Yeah. So really, I mean, I would say we have an enormously strong bench inside in our digital health and analytics group, focused on our AI program, but also really focused on AI ethics. And how do we make sure that we're identifying the right individuals, targeting the right services from the range of, the things that Humana has to offer, and being really proactive and being that partner to our members. So a lot to talk about, but I would say that's sort of at a high level where we are.
Yeah, before we move to Sam, I just want to put an earmark regarding AI ethics. If we have time, I think our audience would love to hear a little bit more about that. But Sam, can we pivot to you for an introduction?
Yeah, absolutely. So good morning, everyone. Thank you so much for having me. I'm also looking forward to the conversation. So doc.ai, we are a startup. We are 4 years old. We started in 2016. So we are an AI enterprise platform company. And so what we have built for the last 4 years is a digital health platform that enables the collection of any type of health data and real world data to create very engaging and personalized experiences, to provide new type of analytics and predictive models. It translates into a suite of products and solutions that we have already deployed across different populations. One of our largest customers is Anthem. We've been working for Anthem and with Anthem for almost 3 years. And it's been really an exciting journey because we've helped them become a digital first company. And so all the things I described have been already deployed at Anthem at scale. So we're talking about product and solutions to not only create direct member-facing solution experiences, easy to consume and to use, but also deploying machine learning environment to be able to build new type of models for clinical models. As well as, which is another part of AI. I know we are not going to address that today, but it's a very important one, using our AI tech stack to build trust by keeping the data private and also working on the infrastructure level to enable the launch of all those products and services rapidly and at reasonable cost.
Great, thanks, Sam. Michael, thanks for joining us.
Sure. Thanks for having me, and I appreciate being here. So this should be the easiest question of the panel for me, but as only being in the company for 7 days now, in the new combined company, it's a little bit tricky, but I'll do my best. So Teladoc Health is the global leader in virtual care, and we enable, deliver, and empower access to whole person care. With a focus on driving better outcomes through innovative care delivery. We're focused on the full spectrum of care, everything from acute and general medicine triage through specialty and chronic condition empowerment. We've brought together two great organizations in Teladoc Health and Livongo, which now brings together a network of over 3,000 physicians, combined with seamless connectivity, applied health signals, and that human touch model, all focused around the member experience and really empowering the member to live better and healthier lives. And so extremely excited about this combination. To your AI question, which I know all the panelists will get into deeper, data and AI are really at the core of what powers the organization. We used to say at Livongo we have more data scientists on staff than we do IT engineers, and it is that opportunity of bringing together what is one of the largest databases in the world from a diabetes and hypertension perspective. Again, together with that physician interaction that we're extremely excited about and think there's a tremendous amount of opportunity to improve care and importantly, improve the consumer experience.
Great. Well, thank you all again for joining us. What I love about the panel, while I know you all bleed into each other's universes, is we've got a payer organization that is a whole lot more in Mona, a care delivery organization that is a whole lot more in Michael, and a technology and analytics company in Sam that is also a whole lot more. And so I'd encourage us as we get into this, I'll toss questions to each of you individually, but I'm a firm believer in open and active debate. So if there's disagreement, I'd strongly encourage you to speak up, because I think that's the whole point of this. So I'm going to start with you, Michael, with my first question. we're in the midst of a heartbreaking, unsettling, and unprecedented time where, frankly, patients can't easily access healthcare, increasingly can't afford healthcare, and are, in this period of crisis, scared to receive healthcare, or are disadvantaged or marginalized because of disparities related to healthcare. So my question for you is, how have these crises altered your thinking about care delivery, about AI, about telehealth? Let's start with you, and would love to really hear from everyone.
Sure. So I'll start with that. It hasn't so much altered my thinking as more so it's reinforced that we're on the right path. When you think about it, and first off, for everybody on the front line delivering care and triage care, during this time, thank you, because it's great work that you are all doing and putting yourselves in harm's way. I think, it's hard to find bright spots in what's gone on, but if there are a few, one of the bright spots of the pandemic here has been, it has triggered that really hard first step for people. I remember the first time I ordered something online, and I probably hovered my finger over the purchase or go to cart button for quite some time. And then I pressed it and I realized not only was that not so scary, but it created a better experience and it created a better outcome, and it was really easy. And so, the pandemic has kind of opened up that click of that first button, where people see there is a different way and a better way to receive care. And I think that will ultimately be that driving force or that benefit coming out of what has been a terrible situation. And the reason why I say that is what we've seen some interesting things. And while both Livongo and Teladoc services were on an increase well before the pandemic, again, that expansion of people clicking the button the first time has obviously accelerated. And one of the things we've seen as part of that acceleration, which we watch really closely as an organization, is Net Promoter Score. And through this increase in utilization and increase in volume, and through this first click experience, we've actually seen our NPS scores increase across both our virtual services as well as our chronic condition services. And that's a great sign and signal that says people like this and they want to use this. As for some of the other aspects around disparities and things like that, and I'll go with my visual aid here. This is a great equalizer, and the phone, whether it's phone or virtual, really has the opportunity to even the playing field. And as we've gone out to market with our chronic condition services, starting first from a commercial perspective and ASO business, moving that into all aspects of commercial, into Medicare, into Medicaid, where Teladoc Health has a significant footprint, and into the ACA, we continue to see similar trends across each of those segments, where adoption is really high, satisfaction is really high, and importantly, those clinical and cost outcomes are improved. So we think we are encouraged around what we're seeing there. We've actually had more than 1 billion virtual visits are estimated to occur throughout 2020. And we see that trend continuing as people have seen that not only is it not scary, it's easier, and again, the experience is better.
So Michael, I think you've appropriately pointed out that the pandemic has certainly instigated patients to really try telehealth where they perhaps haven't done it before. But I guess my question is will it stick? Is this a novelty so that out of necessity people are using telehealth, or they're, I'll give it a go and they'll revert back to sort of the way things were? Or do you think that there will be some longer term adoption?
Yeah, so I think it's a fair question. Time will tell, certainly, but we do have a set of fact set that points to once people see and experience a more convenient approach, once they experience and see that the value of that interaction is increased, that they stay with that experience. Now, that certainly doesn't mean people will not use bricks and mortar anymore at all. I actually think the future lies in an elegant choreograph of services that are virtual, services that are digital, that show up just in time, just when you need it, as well as those in-person services. But to use maybe a Livongo statistic, we see very little once people enroll in the program. We see few people actually disenrolling in the program, less than 10% annually. And so we think once people use it for the first time, they really see the value, they get that high NPS score, that high satisfaction. That's what keeps them sticking with the service, again, that works and they like.
Thanks. Mona, Sam, your thoughts on this as well?
So
Go ahead.
yeah,
Yeah.
Okay, no, absolutely. So I totally agree with Michael. So mentioning the phone is so important, especially in the AI story. So what Michael was describing is how now the healthcare industry has the opportunity to focus in treating patients as customers and giving them the experience they deserve. When you say sticky experience, it's true. Healthcare experiences have been awful historically. People do nothing than complain. So I think that indeed using that super powered computer that everybody has on their phone is a great opportunity to create those kind of experiences. I think where the AI plays an interesting role as well is how you can, for example, what we've been doing is really leveraging on every single component that the phone has. It's full of all kind of sensors, of technologies that you can leverage on that can augment that experience that we are talking about in data collection. So we see already not only in direct-to-member experiences, but also in clinical trials, because we've been using our platform for clinical surveys and trials as well. The quality and the integrity of the data collection is way superior to what we used to. The breadth of data that you can collect is also much bigger. We can go beyond traditional data like claims, medical record. We can go to real world data that people are already collecting on their phone. You can leverage on voice, on chat, on video, things that people already use heavily on their phone and build new type of biomarkers that can feed that feedback loop of creating more pleasant but also personalized experience that can help us build better understand the patient, have that 360 view that we never had a chance to have before, and potentially measure and have better clinical outcomes.
Yeah, I would only add, agree with everything. I would only add that there've been so many point solutions within the healthcare space, right? I think part of the challenge is to say, how do we integrate those into seamless experiences for our members, both in person and digital? And then I think there's we have to really learn into how do different individuals want to engage, right? And what are their preferences, and how do we really tailor those experiences to their preferences? And frankly, there's just a lot of learning that organizations have to do that I think the healthcare ecosystem in general has to do in order to get there. What do we know about a particular senior and their environment and what they might have access to that would tell us that, the starting point doesn't need to be digital, it needs to be something more akin to in-person. And what might we know about somebody else where we think, there is a role for us to actually digitally enable them so they can get to, and even if they haven't had that facility before, be able to become much more digitally engaged. So that sort of level of personalization and how we tailor those experiences, I think, is going to be fun. It's going to be challenging, and it's going to involve a lot of novel partnerships, for us as well.
Thanks, Mona. Let's stay with you, Mona, if we could. One of Michael's comments sort of triggered a response. So your thought about the first time that you bought something virtually, and your hesitation, and it all turned out okay. Well, in my own personal experience, the online shopping experience is so easy. I very much believe that I overshop because it's so easy. I think I'm buying things on Amazon that I definitely don't need. So I want to ask Mona a question about value and affordability of healthcare. To date, we've predominantly used AI for administrative purposes, and some would argue that AI has focused on unit cost efficiencies as a means of driving up the volume of healthcare, not driving down the volume of healthcare. Do you envision that the future will hold more of the same in how we think about AI, administrative focused in a volume world? Or do you think it's going to pivot, and if so, how, to something that's more clinically oriented and focuses more on value over volume?
Well, as a former Fed, I will never say that we're going to stay within the volume world rather than move towards the value world, right? So, but I might, Craig, give an example of actually something that Humana has done during the COVID period, where we really leveraged AI. And so, we have millions of members. The initial weeks and months of COVID were very scary for all of us, and particularly I would say, for the older population, given all of the impacts of COVID. And we really had this charge to say, how do we proactively reach out to members to see what they might need, and how do we even figure out who to reach out to? And so we really used, all of our internal data sources and our algorithms that we have for really predicting who's at risk, to really do some fairly deep risk stratification, actually not just within our Medicare Advantage line of business, but also within commercial and Medicaid, and really use that to say, who do we proactively make phone calls to, who's at a high clinical risk for a variety of reasons. And what we learned, and this was interesting, is that it wasn't just the healthcare needs that were surfacing, right? It was also a lot of the basic needs that were getting surfaced, food and housing insecurity, and getting access to transportation and those kinds of things. But the core component was really using our data to help risk stratify our members in as smart a way as possible. And we were able to do that because, again, there's a really strong internal AI program. And frankly, that's going to be a core component of the ways in which we develop our care models or end-to-end clinical programs, and how we think about deploying various resources from across Humana. So there are a set of investments that we've made within the home segment. There are a set of investments that we've made on the digital side. Well, for a particular member, let's say, who has, advanced CHF, what shows up for them across all of those assets? Like, how do we first identify those members, and then how do we think about, in a seamless way, as one Humana, showing up with both a digital set of experiences as well as an in-person when appropriate? And that is, at its core, going to be embedded, it really starting with our data and our AI program. So I'm really excited about that. I think it's going to help us really learn not just what resources we deploy, but also how is that accepted by that individual, and what can we learn moving forward about what else we might want to consider offering that person.
So Michael, in a similar vein, is your organization's business model oriented around, do you do better in a world that sort of stays volume oriented, or are you incented, motivated, and will continue to seek out opportunities to do more in a value world?
Yeah. So first off, we're focused first and foremost on the member and the member experience. And I think it's important to anchor around the expectation to your value question. The expectation of virtual care should not only be a better experience, but it should be a better experience and a better outcome clinically and a better outcome from a cost perspective. That should be all of our objectives, and it's certainly Teladoc Health's focus. And now that utilization is increasing, the emphasis and opportunity around that total value equation becomes even greater. And let me give you just maybe a little bit of an example of that through a very quick story. So as recently as my father battled cancer throughout this pandemic and prior, I used to go to his office visits with him when it was in person. And obviously with the pandemic, things changed rapidly and went to virtual visits. And what I saw in that virtual visit was a distinct change in the quality of the visit. Not so much, frankly, that his physician, who was the same physician he was seeing in person, changed necessarily. It was in how my dad and I interacted. In-person visits, oftentimes it was me kind of asking the questions, seeking more clarification, drilling into next steps and things like that. When my dad was on video, he was doing things like I'm doing during this conversation. He was taking notes. He had his kind of information in front of him, and he was calmer. And he really led that conversation versus me in that scenario. And so I think that expectation of not only different, but better, and better defined as experience and outcomes, both clinically as well as financially, is what we are focused on, and is what I think the expectation and objective of the marketplace should be.
Great, thanks, Michael. Sam, I'm going to direct this next question to you, but I think this will be a rich discussion that everyone will have a point of view on. I'd love for you to all take out your crystal ball. I want to ask a question about the future and what you think the future of care delivery is going to look like. The where and the how of what the care model will be. After the pandemic passes, will we go back to the way things were, or will we go forward? And I've been very outspoken on this as well. We started at a 99%, 99% of our claims were paid for face-to-face visits and 1% for telehealth visits. And in the first 3 months of the pandemic, it flipped to the exact reverse. 1% face-to-face and 99% virtual, with very high telehealth volumes. So what does the future look like? I'd also, just to really focus the question, we did get an audience question that's asking, what should we expect the percentages between physical and virtual will be in the future? And I'd also add the variable that it may just not be binary. It may not just be virtual visits or go to the doctor, ER, urgent care, or hospital. We may see the return of the modern house call. So I'd love for you to broaden your thinking beyond just AI and telehealth to give us your sense of what the future will look like. And don't be afraid to give percentages and numbers as well. Sam, do you want to start, but would also love to then hear from Michael and Mona?
Yeah, sure. So this is the thing. So clearly, we've been, our mission of unlocking the value of data and accelerating digital transformation in healthcare, has been our mission since day one, before the pandemic. So we clearly see how COVID-19 has accelerated this mission. I don't think we are going back. We are not seeing that. And I believe in a hybrid model. And I believe what we are seeing right now is simply that AI is simply becoming part of the team. It's not replacing anyone, it's augmenting, and it's becoming part of the team. What is extremely important is really to understand the data that is available, the clinical flows, and how we can apply AI to those, to that data that is available and those flows to Michael's points for better health outcomes and saving costs there. What I would like to say that is very interesting is at doc.ai we do not only work with health plans, we work with providers and pharma as well. And what is extremely interesting is that that trend of moving forward and becoming highly digital, digital first is a trend for everyone. It's not only health plans. So that's why it's very interesting. It's a trend across the entire industry. And what we are seeing more and more is that idea of thinking in terms of platform, an AI data-driven platform that is able to collect all that data, process it, repackage it in data products that can be redistributed to members, to partners, and potentially exchange all that is really on everybody's mind. So I don't think we are going back. I do think it will be hybrid. And again, it's a matter of really understanding, the clinical flows. And again, I like very much what Mona said, because we see that as well. What you were describing, Mona, the social determinants of health, when you build new type of models, when you depending on the disease state you are looking at, the social determinants of health, access to care, access to food, access to transportation, can have a high impact on that last milestone for care delivery. So it's very early, but I don't think we are going back. I think this is all the numbers we see are telling us that this is moving into that direction.
Michael, what do you think?
Sure. So maybe a few thoughts. First off, I do believe in what will be the least surprising thing of this panel. I do believe virtual care is here to stay. So sorry for the spoiler alert there. But it's here to stay. I think for a few reasons. And we are right to be mindful of the utilization question. I do believe that's a right thing to be mindful of. That said, members, whether it is a in-office visit or a virtual visit, consumers don't wake up thinking, I can't wait to go to the doctor today. And so I think we've got there's a long way to go between overusage and the right amount of usage. And I think as we think about that right amount of usage, I do believe this is where AI plays a significant role. And the model that we establish plays a significant role. And to Craig, your challenge a little bit, I also think about virtual care in a much more dynamic way. From the standpoint of, virtual care gives the opportunity for us to deliver health and care on the member's time frame, not on the industry's time frame and the market's time frame. One of the interesting stories that came out of the pandemic from a Livongo perspective was we started to see an increase of calls of members calling us at all hours, night, day, on down the road. But they weren't just asking about their chronic condition. They were asking about things that actually had nothing to do with their chronic condition or just general kind of how should I be prepared and what should I do? And we actually asked a few of them and said, well, here's what we think, but why are you calling us about this? Why wouldn't you have called, XYZ or someone else? And their response was because we knew you would answer. And so I think the virtual care offers this opportunity around the member experience, around a never intrusive but always there type model, around a contextually relevant orientation that says whether it is a virtual visit or it is an inpatient visit or it is that seamless digital connectivity, that it's relevant, it's personalized to the individual, and it solves the need at the right time. And I think that is where AI comes in significantly. So to your question and to the audience's question, I don't think we will ever go back to the pre-COVID of 99% visits in person and 1% virtual. I also do not think we will sustain a level of 1% in person and 99% virtual as in the first 3 months of the pandemic. I think we have to establish what a new baseline is across an optimal utilization pattern that for members that allows them to live their life while putting health and care as a supporting and an empowering aspect of their life. And I think the data and AI that we have, that's an absolute achievable expectation.
So let me put you on the spot, and then I'd love to hear Mona's perspective on this as well. And my question is really directed at the primary care model. Do you envision the future will be that we all will actually have an AI PCP, a telehealth PCP, that the first step in care will be virtual, will be AI driven, with the traditional care delivery system in many respects becoming specialists, that they're recipients of services when things need to be face-to-face? Or do you envision that we'll maintain the existing primary care delivery model with physicians utilizing telehealth as simply a care delivery modality?
So I will say yes. And so what I mean by that is this: I think there's a tremendous number of primary care physicians that are delivering fantastic value, fantastic results for their patients and their patient panel, largely delivered from an in-person perspective. And I think those high value physicians, you'll see them start to expand into what they're doing in person, can they do better or the same virtually at a lower cost? And I think you'll start to see that expansion. At the same time, I think you'll see services like Livongo and Teladoc Health in, for Livongo services on the chronic condition space, 20 to 30% of the folks that utilize our service actually do not have a primary care physician. That's an opportunity. Frankly, those folks are utilizing our services in sort of that capacity. And I think you'll see that grow out from virtual first into that extended primary care model. That is a virtual first primary care model with specialty wrappers. I think you'll see both models start to mature and meet in the middle at the end of the day. Where I will also see happening is low value providers that are wedded to old models will begin to struggle, because the other piece of virtual care is it does eliminate geographic barriers as well. And so you now have the opportunity to increase not only your panel size, but increase the span and reach of the members you can impact.
And increase accessibility for those disciplines that have had geographic barriers like behavioral health and mental health as well.
I was just going to say behavioral health in particular, in that, especially from an access and an open door perspective, for sure. But I'd love to hear others' thoughts on this as well.
Mona, what do you think about all this?
So I don't think that there will just be, one or two models that'll emerge, right? I think a mistake from what we've been currently going through is to say it's going to be virtual first, or people prefer, in the home. I think if you look at the investments, for instance, that we've made within the primary care clinic space, within a entity like Heal for providing primary care in the home, or dispatch for urgent care in the home, or some of the partnerships on the virtual side, I think we're trying to look at is what are the models that bridge each of those different components, and how do we figure out what's most effective for what particular set of things, and tracking, frankly, both the set of health outcomes as well as, does it make financial sense? Because we want to be able to scale those across larger populations. So I think there's great opportunity to look at, a couple of different business models that can really emerge through this time. And I'm actually really excited. I think there's an enormous opportunity to help to build that ecosystem of how do those things intersect and talk to each other? How do we figure out the right next, best intervention for that member? And in that process, also, how do they like to engage? How do their families like to engage? So, I think it's going to be a little bit messy the next couple of years. Healthcare always is. But again, I think it's going to be, I'm seeing it as an opportunity to really think about new business models as well.
What I'm hearing from all of you, which it warms my heart, is that we're going to have the rise of the consumer again, and that the model that will likely prevail is the one that consumers most want, that is high quality, most accessible, most convenient, most affordable. And beware to those of us who are incumbents that are resistant to change, because there's going to be disruption in the industry that really focuses on what consumers need. So let's pivot and talk about payment, if we can. And this is going to be a bigger question. I'm going to make it a little bit bigger, and we'll probably start with you again, Mona. Right now, I think for many payers, we've harmonized the payment for face-to-face visits with telehealth visits, just as a way to not create perverse incentives and to really open up accessibility. Will we envision that harmonization will continue, that we'll continue to see payment for telehealth organizations or care delivery organizations that have adopted telehealth as equal, or do we see that as different? And then if we don't see them as equal and telehealth reimbursement is lower, which I would imagine would be the way to go than face-to-face, then will we see a tug of war between telehealth organizations that are trying to maximize their patient base and care delivery organizations that try to maximize fee-for-service or face-to-face? Let's start with you, Mona.
Yeah, I think the underlying point there, Craig, is not just this distinction between in-person and virtual, and that's not the extent of the innovation, right? The innovation is also, as I was saying earlier, going to involve the underlying business models and the payment structure. Frankly, I don't know how that'll evolve. I think part of it we're going to have to work closely with policymakers as well, and I'm sure MedPAC is going to be taking a look here as well. There's been some studies and continuing studies to say, how do health outcomes look for virtual visits versus in-person visits? I'm not sure that I would see any reason for those to be markedly different, but I think it is something that we need to continue to track. I would agree with you. I think over time, I know there's been an emphasis on payment parity, but over time, how does that evolve when we don't have the the overheads that we do, frankly, for an in-person visit? So I think I don't have a clean answer, frankly. I think it's something that we're going to have to think through and what do value-based sort of contracts look in that space when we are managing a population that maybe is primarily getting its care virtually. So I think those are going to be ongoing discussions.
Michael, what do you think about this? And I'll tie in an audience question with you, Michael. One of the questions was as we look to getting back to normal eventually, or I guess the new normal or a better normal, however we want to describe it, what initiatives is your organization driving to ensure retention of those patients who tried you, who you'd love to keep, but there could be, to my point earlier, this tug of war or this pull back to the prior care delivery model?
Yeah. So great question. I'll maybe try to tie your initial question together with that one, which is, I'll be honest, even as Mona was talking, my initial reaction was going to be, yes, of course, virtual care visits should cost less than an inpatient visit, and should have go back to more of that tiering. But as I was thinking that, I actually went back to, Craig, something you were talking about earlier, which is this definition of value, and actually the story that I was telling, about my dad's visit, where that virtual visit was more valuable, both to the member, in that case, in my dad, and as well as from an outcome of that visit. It was the first visit we probably followed all the instructions perfectly, and so there was actually more value coming out of that visit. So I think there's a quick answer to say yes, virtual care should be less than in person, but I think the broader question is, how are we going to define value as we move into this very dynamic world, and how will we reimburse and pay for that value? Of course, there's the risk equation that I think is going to continue in value-based care, which I think will continue to play a significant role. And then that actually does bring into the audience question around, how will you keep that member? And I think the interesting part, again, I don't have the answer for this, but the interesting problem that collectively I think we have to solve for is this interesting dynamic where in one aspect of care, we want to get away from fee for service, and into value. Interestingly, in other aspects, we want to actually try to measure and line item fee for service, if that makes sense. So what I want to do is make sure that we are, for these members that engaged with Teladoc Health across all of our services, whether that's acute all the way through to chronic, I want to make sure that I maintain a relationship with that member and with that consumer. But what I think we have to figure out and be careful of is, if my sole motivation is they have to talk to me every month, they have to interact with my digital service every week, or in some predefined way, that creates now an incentive for groups like mine to constantly interact with the member, even if it's not right, even if it's not the right time, even if it doesn't add value, versus looking more holistically and stepping back and saying, how do we create a dynamic and a model for the member that is optimal, that has the highest level of satisfaction and the best outcomes? That's a really hard problem. It's easier said than done. But as I think about that question, I'm not sure I would declare one should be higher, one should be lower. I think we have to step back and say, what are the new measurements of value, and how do we align that value to the different participants within the ecosystem?
And the new measurements of value, again, what I said earlier, is really going to be derived by customers.
Yes. Yes.
I mean, I think that ultimately, people will walk toward the model that they find most valuable, and I very much like to consider that healthcare will be disrupted just like other industries have been disrupted, in the same way that we've seen digital revolutions in transportation and entertainment and retail. If we come up with a higher value digital model in healthcare, consumers may very well find that far more rewarding and preferred over the way that we used to work. So
defined broadly, defined as that whole person, sure, which again blurs the lines between medical and behavioral as well.
So I've got one more question for you all in our remaining 4 minutes or so, which is what's getting in our way? If you were to have a wish for something that could be fixed or something that could be done, whether it's policy change, incentive change, improved technology. If we believe the future is going to be about AI and about virtual, what would you wish would need to be moved out of the way or would need to be accelerated to make this happen? Sam, let's start with you.
That's a very, very difficult question because we're talking about healthcare here. And so, you know, I've spent my life building companies at the intersection of tech and research, and I moved into healthcare 15 years ago for very personal reasons. And what I discovered back then is healthcare definitely is a very different industry, and everything takes so long, and it's a combination of things. It's not only regulation, it's also mindset, it's also business model. And one of the big aha moments for me when I moved into healthcare is I realized that the business models in healthcare, you know, coming from my very naive background of a caregiver, the business models in healthcare were not built to serve patients as consumers and customers, which created very weird dynamic and horrible experiences. Honestly, I'm going to give a very naive answer, but it's not naive. At the end of the day, I think it's a mindset. It's being able to meet the right people in the organizations who have the mindset and the courage to see that it's happening and to pilot, to experience the value of what these AI technologies can bring today, because there's no way back. To jump back on what Michael said, COVID-19 is taking all the oxygen in the room, but there is another tsunami coming, and that's mental health. The numbers are mind-blowing, and so we won't be able to meet the demand. So virtual care, telehealth will be a big help there, but again, we'll need to scale by using technology. So mindset.
Great, thank you. Mona, quickly, and then Michael.
I'm actually just going to double down on that. I think we lack imagination often in how we problem solve, and we work on the margin. So I think that mindset and creativity within healthcare is just essential.
And Michael, final words.
I love that. And I do wish, and I'm going to go order a crystal ball from Amazon for my next panel for sure. So that's one of the things I didn't click on. But actually, I will go a little bit more technical and maybe blah in saying advancement of our actuarial models to really adjust for where the future of healthcare is going.
So it sounds like bravery, innovation, and really embracing a new paradigm is what you're all wishing for. Well, I want to thank you all. It's been fun. It's been a pleasure, and hopefully we'll have a chance to do this again. Thank you all for your time and your expertise. Your answers were wonderful. And for our audience, thank you for tuning in, and stay tuned for the next panel shortly.
Bye, everybody. Thank you, guys.
Thank you. Bye-bye.
Thanks, Greg.